Hey everyone. Today, we're diving into an incredibly important topic: high cholesterol, a silent yet serious threat to your heart health. Most people think of cholesterol as something that only affects older individuals or those who eat an unhealthy diet. But here's the reality: high cholesterol doesn't discriminate. It can affect anyone regardless of age, weight, or lifestyle. And the most concerning part, it often has no clear symptoms. That means millions of people are living with dangerously high cholesterol levels without even realizing it. How common is high cholesterol? Let's take a look at the numbers. In the United States alone, nearly 93 million adults have higher than recommended cholesterol levels. That's almost 40% of the adult population. Globally, it's even worse. Studies suggest that over 1/3 of the world's population has high cholesterol, putting them at risk for heart attacks, strokes, and other cardiovascular diseases. Why is cholesterol so dangerous? Cholesterol is a fatty, wax-like substance that circulates in your bloodstream. While your body needs some cholesterol to build cells and produce hormones, too much of it can be a serious problem. When cholesterol levels get too high, it starts to stick to the walls of your arteries, forming thick deposits called plaques. Over time, these plaques narrow and harden your arteries, making it harder for blood to flow properly. This condition is called atherosclerosis, and it's one of the leading causes of heart attacks, strokes, peripheral artery disease, and high blood pressure. When a cholesterol plaque completely blocks an artery, blood can't reach the heart, leading to a heart attack. If a cholesterol plaque or blood clot blocks blood flow to the brain, it can cause a stroke. Cholesterol buildup in the arteries of the legs can cause pain, weakness, and poor circulation. Narrowed arteries force the heart to work harder, increasing blood pressure. Who is at risk for high cholesterol? Many people assume that only those who eat a high-fat diet or are overweight have high cholesterol, but that's a huge misconception. There are many factors that can contribute to elevated cholesterol levels, including genetics, diet, lack of physical activity, smoking, diabetes, and age and gender. If your parents or grandparents had high cholesterol, your body may naturally produce too much LDL, or bad cholesterol. Even if you eat well, you might still have higher levels due to genetics. While dietary cholesterol isn't always the main culprit, eating a diet high in processed foods, trans fats, saturated fats, and excessive sugar can cause LDL cholesterol to rise. Regular exercise helps increase HDL, or good cholesterol, while reducing LDL cholesterol. A sedentary lifestyle can contribute to unhealthy cholesterol levels. Chemicals in cigarettes damage blood vessels, making it easier for cholesterol to stick to artery walls and form plaques. People with diabetes often have lower HDL and higher LDL, making them more susceptible to heart disease. Before menopause, women tend to have lower LDL cholesterol levels than men, thanks to the protective effects of estrogen. However, after menopause, women's cholesterol levels often increase, raising their risk for heart disease. Why you might not know you have high cholesterol? The biggest reason high cholesterol is so dangerous is that it doesn't cause obvious symptoms in its early stages. Unlike high blood pressure, which may cause headaches or dizziness, high cholesterol often goes unnoticed until serious complications arise. This is why regular cholesterol screening is so important. The only way to know your cholesterol levels for sure is through a blood test, which measures total cholesterol, the overall amount of cholesterol in your blood. LDL cholesterol, also known as bad cholesterol, the type that contributes to artery blockage. HDL cholesterol, or good cholesterol, the type that helps remove bad cholesterol from your bloodstream. Triglycerides, a type of fat that can contribute to heart disease if levels are too high. Doctors recommend that adults get their cholesterol checked at least once every 4 to 6 years. But if you have risk factors like family history, obesity, or high blood pressure, you should be tested more frequently. 10 warning signs that your cholesterol may be high. Even though high cholesterol doesn't always cause symptoms, your body may send you subtle warning signs that your arteries are becoming clogged. Today we'll go over 10 surprising symptoms that may indicate your cholesterol is too high. If you notice one or more of these signs, it might be time to get a cholesterol test and take action before it's too late. Let's start with the first sign. 1. Fatty deposits under the skin, also known as xanthomas. One of the most visible signs of high cholesterol is the formation of fatty lumps under the skin, called xanthomas. These yellowish, bumpy growths often appear on the eyelids, a condition called xanthelasma, elbows, knees, hands, or fingers, and even the buttocks. Why does this happen? When cholesterol levels are extremely high, your body struggles to clear excess fat from the bloodstream. Instead of being removed efficiently, cholesterol gets deposited in the soft tissues under your skin. Xanthomas can vary in size, some are tiny and barely noticeable, while others grow into large wart-like lumps. They aren't painful, but their appearance can be concerning. In severe cases, they can become inflamed, red, or irritated. Are xanthomas a sign of danger? Yes. While xanthomas themselves aren't harmful, they are a strong warning sign that your cholesterol is dangerously high. They often appear in people with familial hypercholesterolemia, a genetic condition that causes extremely high cholesterol, diabetes, liver disease, obesity, or metabolic syndrome. Real-life example, the warning sign that saved a life. A 45-year-old man noticed small yellowish bumps on his eyelids but ignored them for over a year. Eventually, he saw a dermatologist who recommended a cholesterol test. His results? Total cholesterol. 290 milligrams per deciliter, way above normal, and LDL cholesterol, 190 milligrams per deciliter, extremely high risk. His doctor told him that if he hadn't gotten tested, he was at high risk for a heart attack within the next 5 years. After making dietary changes, exercising, and taking cholesterol-lowering medication, his xanthomas gradually disappeared and his cholesterol returned to normal levels. High blood pressure. Ever feel like your heart is working overtime? That might be because of high cholesterol blocking your arteries. How are they connected? When excess LDL cholesterol, which is the bad cholesterol, builds up inside your arteries, it forms thick plaques that narrow the blood vessels. This makes it harder for blood to flow, forcing your heart to pump harder, which increases blood pressure. Warning signs of high blood pressure include headaches, dizziness, shortness of breath, and chest discomfort. If left untreated, high blood pressure and high cholesterol together can lead to heart attacks or strokes. Chest pain, also known as angina. Feeling tightness or pressure in your chest. This could be your heart struggling to get enough oxygen due to blocked arteries. What's happening? When cholesterol plaques restrict blood flow to the heart, it can lead to chest pain, discomfort, or even shortness of breath. If a cholesterol plaque breaks loose, it could block an artery completely, causing a heart attack. If you experience sudden or recurring chest pain, seek medical help immediately. Rapid or irregular heartbeat, also known as arrhythmia. If you sometimes feel like your heart is racing, fluttering, or skipping beats, high cholesterol could be playing a role. Why does this happen? Clogged arteries make it harder for the heart to pump blood efficiently. The extra effort causes irregular heart rhythms or arrhythmia. When to worry? If you feel palpitations that last several minutes, if your resting heart rate is consistently above 100 beats per minute, or if you experience chest pain, dizziness, or shortness of breath. Final thoughts. Take action now. Now that you know the 10 warning signs of high cholesterol, what should you do next? Get your cholesterol checked. A simple blood test can tell you if your levels are too high. Eat a heart-healthy diet. Add more fruits, veggies, and omega-3s, and avoid processed foods. Exercise regularly. Just 30 minutes of movement a day can improve circulation. Stay hydrated and manage stress. These small habits can prevent serious heart issues. Have you experienced any of these symptoms? Let me know in the comments below. If you found this video helpful, hit like and subscribe for more health tips. Watch this next video to learn how to unclog arteries naturally.